I would like to thank Asia Pacific Society of Cardiology for providing me and my society this opportunity to present on the current issues and future prospect of cardiac sciences in Nepal. My society, the Cardiac Society of Nepal, was founded in 1998 as a non-governmental organization. At present, we comprise of more than 220 individuals, predominantly adult cardiologists, pediatric cardiologists, cardiac surgeons, and cardiac intensivists and anesthetists. The society has a mission to improve cardiovascular care and promote heart health in our country through professional activities. And we believe that this can be done through scientific evidence, knowledge, and value based cardiac care. And collectively, we can do this through professionalism and collaboration and fellowship amongst our members. Now, to understand the country, Nepal, and its demographics, we are classified as a low middle income country based on the World Bank classification. Still, 79 to 80% of our people live in the rural areas. And if you look at the minimum wage, we still have 25% of our population in the poverty line. The life expectancy at birth is 71 years. The female life expectancy is better than males. And our GDP per capita is $1,151 as of last year. And at present, the general health expenditure from the GDP still remains low at 5.8%. Coming to our health system capacity, important and a burden for this country still remains that 50% of our healthcare expenses are covered out of pocket, and it remains a huge financial burden to the general population. We don't have a good or a strong nationwide, national or private insurance that covers general health. The government has started a national health insurance scheme, but at present it has only covered 10% of the population, and it basically covers for the government institution as well. And if you look at the slide below, there still remains a substantial number of private centers, such as private hospital, polyclinics, and registered clinics that provide healthcare in our country. Although we do have government hospitals, primary healthcare centers, as well as urban healthcare centers and rural community health units. Among all the districts in the country, only 37 of the districts have a PEN package, which comprises of package of essential non-communicable disease. So what this does is helps identify hypertension or diabetes in its initial phase in small centers, and that can ensure that treatment can be provided in these centers, and basic primary CVD care can be provided by these small centers. Now, if you look at the health system capacity, the physicians, we still have around 9 per 10,000 population. Our nurses is still lower than what the WHO recommend of around 21 per 10,000 population. We provide around zero point 0.7 hospital beds per 10,000 population. And if you look at our cardiologist number, it's 0.06 per 10,000 population. Our country does have training centers, and we are looking to train new cardiologists and cardiovascular surgeons. At present, there are 4 centers in this country that run the DM program for cardiology or the MCH program for cardiovascular surgery. And at present, there are around 25 cath labs in our country, but the numbers are gradually and steadily been growing. There are 11 centers that can provide cardiovascular surgery in this country. However, the majority of the cardiovascular surgery continues to be done in Kathmandu and the bigger cities. In 2019, there were approximately more than 3,000 percutaneous coronary interventions done. around 2,200 cardiac surgeries done, and around 1,300 pacemaker implanted. Now, if you look at the cardiovascular governance part, whether with regards to national strategies or plan addressing CVD, it falls under the multi-sectoral action plan. The dedicated budget for cardiovascular disease remains still abysmal, around 0.2% of the total health budget on total health budget. There are no plans for rheumatic heart disease prevention and control. The government has run certain schemes which basically provides treatment of patients with cardiovascular diseases, like the Children Assist Program or the Child Assist Program, which provides cardiovascular surgery as well as cardiovascular intervention for children less than 15 years, which is covered by the government. And similarly for the Senior Citizens Scheme, where individuals above the age of 75 years can avail treatment. Recently, the Rheumatic Heart Disease Program has allowed treatment with valve surgery or mitral balloon valvoplasty, which does not require payment from the individual, and the government takes care of this service. We also have started a program called a Bipanna, which basically implies the less economically viable individuals, where they avail up to 100,000 Nepalese rupees for treatment of various heart ailments. The emergency procedures in cardiovascular disease in government institution is free, and the government does take responsibilities with regards to the financial burden with regards to it. However, the country still does not have any definitive program on preventive cardiovascular medicine. Recently, our society looked to develop a cardiovascular disease risk profile of Nepal, and some of our society members individually looked into various manuscripts, papers, government pamphlets, and we've worked to take out a cardiovascular disease risk profile of our country. And what we've recognized is the prevalence of hypertension is around 28 to 35% based on different manuscripts, and the prevalence of rheumatic heart disease is 0.9 to 10.2 per thousand children in different areas of Nepal. Coronary artery disease, the prevalence is around 4.8 to 5.7 in the urban population, much less in the rural population. The prevalence of tobacco use is high among males compared to females. Like I mentioned earlier, the presence of raised blood pressure or hypertension varies from around 28 to even up to 38% in males, and the raised total cholesterol is around 11%. The prevalence of obesity is around 3 to 5%, and the prevalence of diabetes is around 5.8% in the population. We also did try to look into the treatment of heart diseases, and this is a manuscript that was taken out from the STEMI Registry from the National Heart Center of our country, where we found that reperfusion was provided in 31% only, with primary angioplasty being done in 25%, and the mortality was around 6%. So there is a lot of work that can be done, and I think it's been very important that we did look into developing the cardiovascular disease profile. And with this, what we've seen is that there is a major role that the Cardiovascular Society or the Cardiac Society of Nepal can play. So our society have started, we've identified certain areas where we think that would help improve our goals. And one of the things that we've done recently is taken out a concise text or a update book on cardiovascular disease. and at present it is in the press. We hope to have it published and distributed in the coming few months, and we plan to distribute amongst our members to the government hospitals, small primary health centers, and even private centers, medical colleges, so that everyone can have basically uniformity in treatment of heart disease in the country. We believe with this, a standard of care could be achieved in our country, throughout the country, to provide treatment for cardiovascular diseases. The society continues to promote our Nepalese Heart Journal, which is a biannual peer-reviewed journal. Our editors and editorial team continue to work hard, and we hope to have this journal indexed in the coming future. The society also started our national registry in 2018. At present, the registry database comprises mainly of interventional procedures such as coronary intervention, electrophysiological intervention, structural heart disease, and cardiovascular surgery. But we hope that with the start with this, we'll gradually be able to expand our registry, and meaningful and important data base can be established in our country. And I think this would be one of the ways where we could look to enhance the role of our society to improve cardiovascular care in the country. The society has committees. We broadly defined our society because we comprise of comprehensively of a conglomerate of different cardiovascular disease physicians. So we are at present divided into non-invasive cardiologists group, the invasive cardiology, electrophysiology, pediatric cardiology, cardiovascular surgery, cardiac intensive care, and cardiac anesthesia. And all these subgroup or small committees in these subgroups look into improving education. And I'm sure as the years forward, the role of these committees and these small subgroups within our society will continue to grow. Recently, we've appointed two committees which I believe are very important. We formed a committee to look into primary and secondary prevention of rheumatic heart disease. And second is the blood transfusion protocol committee. So what these committees will be looking into is providing an expert consensus on primary and secondary prevention of rheumatic heart disease, and to establish a blood transfusion protocol within the country. And we hope with this expert consensus document, we will be able to push it into the ministry, into other individuals who are responsible for cardiovascular health care in our country, and we'll be able to bring about a meaningful change and improve our CVD profile in our country. The society continues to emphasize on education and conference and seminars and meetings, and the society conducts an international conference every year. It's usually conducted in the fall of the year, and in 2022 we are going to be conducting our international conference in early November. Our theme of our conference continues to remain Conquering Heart Disease in the Himalayan Region, and the next year will be our 20th international conference. And I would like to take this opportunity to invite everyone to visit Nepal during this conference. We as a society also have national level conferences with emphasis on specific heart diseases. We continue to have small CMEs monthly. We conduct workshop on various diseases, and what we now look into is pushing these education programs beyond the big cities into smaller cities or smaller towns, and even smaller medical organizations, so that cardiovascular health care and its importance is well known throughout our country. Now, with this, I would like to conclude my presentation, and I would like to thank APSC again for providing this platform and this opportunity to present my society work and what we see our future in cardiovascular health in our country. Thank you.